Welcome back to class. We're going to try to take everything that we know and we are going to try to palpate some of these muscles in our body. So get comfortable. You may need to put some yoga clothes on so that you'll be able to palpate a little bit better. So let's start with the rhomboids. So the rhomboids, remember, they're on the medial border of the scapula and they help retract the scapula. So one of the ways that we can activate these muscles is coming into tabletop. So coming into tabletop, imagine trying to squeeze your shoulder blades together. So let the heart drop, squeeze the shoulder blades together. And that should help you feel the contraction of the rhomboid. So you might be able to do it here. You can see that I can draw the shoulder blades together. Imagine there's a pencil between your shoulder blades and you can squeeze them. So those are the rhomboids. Now the opposing action is the serratus anterior that protracts. So protracting, imagine pushing away from you, and you might feel that the shoulder blades begin to separate and can dome the upper back as you may hear a cue. So serratus anterior, protract, rhomboids, retract. So let's move on to the rotator cuffs. First one, subscapularis, which is at the front part of your scapula. So that, remember, that is the only one that is in the front face of the scapula, and it's responsible for the internal rotation of the arm bone as well as stabilizing the shoulder. Using your right hand, and you put it into your left armpit, thumb towards the center of your armpit, and you might be able to grab your scapula. And that's your scapula. And where your thumb is, if you press back towards your scapula, that's going to be approximately where your subscapularis is. So it's the back of your armpit. Bend your left arm in front of your belly. And remembering that subscapularis is responsible for internal rotation. It's going to create. So you're going to create your own little pressure by bringing the hand to the belly and pushing in. And you should feel that little activation. If you push your thumb in, you may feel a little activation right on that front face of the scapula. Talk you through it again. Right arm forward, left thumb, try to bring it to the pit or center of your armpit. Fingers are going to grab to the back to feel your scapula. And start to bend your right elbow, hand on the belly, because it's an internal rotation that activates the subscapularis. Press into your thumb and internally press the right hand into your own belly. You might feel a little activation, the internal rotation. So it's very minor. You might not feel too much of it, but that's the action that you're feeling. The next one is going to be your supraspinatus. So supraspinatus requires you to find your spine of your shoulder blade. So finding the spine of the shoulder blade, you can find, we find a ridge, tip of the shoulder, so chromium process, and then follow that, that's the spine. The upper part, if you dig your fingers on that ridge, that is going to be your supraspinatus. Supraspinatus, the action on supraspinatus is, of course, to stabilize, but also abduct. But it's that first initiation of the abduction, because after that, it gets taken over by the deltoids and the traps and the other muscles instead. So if you press down with your fingers above the spine of your scapula, and slowly begin to lift the arm, you may feel the little activation of that supraspinatus. You may need to move around a little bit, find the spine of it, and go right above the spine. And remember, it's just that little micro action. So right above the spine, press the fingers and abduct the arm away from you, just 5 or 10 degrees. And the last rotator cuff, teres minor and the infraspinatus, they're going to have approximately the same kind of action, a little external rotation of the arm bone. And now for this one, because it's an external rotation, we're going to move our arm bone through external and internal rotation. So you can see that the activation. So the hand's going to come and try to grab your scapula from below the spine of it. So you can grab your scapula, cactus the arms, and go from internal, external rotation, and just kind of feel around. You may feel a little bit, when we go external, you may start to feel it turn on. Go back internal, external. And if your hand doesn't reach there, you may not be able to feel it as well. But if you can, you just can grab the scapula and just work internal and external rotation of the arm. You should be able to feel that when you externally rotate, you can feel it turn on. So those are the rotator cuff muscles. So the next group of muscles that we are going to look at are the muscles around the hip area. The first one is the iliopsoas. So the iliacus is from the ilium, so the ear of the ilium, the fossa, and it connects from the fossa and it goes towards the greater trochanter of the femur bone, whereas the psoas connects to the vertebrae and then goes into the femur bone. The psoas is going to be a little bit deeper, harder to find, but let's start with the iliacus. So iliacus, so trying to find the fossa, so you're going to try to find the crest, and you try to palpate down there and push down, legs in front of you, and lift the legs. If you feel something activate, that will be your iliacus. But if you're looking for the psoas, you're going to go even deeper. So you have to go deep underneath your rectus. So the rectus is going to be right down the center, and you have to go deep down, and you might have to curve the spine a little bit. And then from there, push down, and again, activate. You might kind of roll the leg in and out, feel internal, external rotation to feel it out, and then lift the leg, or activate the leg, or draw the leg bone in. But engage, and you might feel it's a little bit deeper, so a little bit harder to palpate compared to the iliacus. And the next opposing action, the glutes. So let's look at the glutes. Glutes are easy. I don't think we need to do too much to find the glutes. Very large muscle in the back, glutes. Great way to feel them, all fours. And take the leg back, and can feel hip is an extension, and you may start to feel the glute turn on. So glute, another way is to experience that hyperlordosis that might cause from overactivity of the upper glutes, is try to squeeze your bum a lot. And you might start to feel the upper glutes begin to contract, and you may feel like the back is starting to kind of pinch in and kind of bend a little bit. And that would be the overcontraction of the upper part of the glutes. So I don't think we need to do too much to find the glutes. The large muscle, we probably are pretty familiar, but glute medius is up to the side. So again, glute medius is on the outer hip. The opposite side is the TFL, which we'll find later. And it's responsible for the external rotation as well as the hugging in of that leg bone. And also abduction, that's the main action. Come up standing if you'd like, and you can balance on one leg even. So for me, I'm going to stay on my knees so you can feel, so you can see more clearly. And when I try to balance on one leg, and I might bring my leg out, abduct out to the side, I might start to feel that activation, possibly in this modified side plank if I'm here. And you can feel that activation. So the posterior side of your hip. The front side is going to be your TFL. I might feel here, the glute med. And then I want to activate glute max. So I might bring my leg back, and I can feel glute max. Take it forward. You can feel that the glute max kind of softens. And lift and abduct my leg. Can feel a little bit more of that glute med right here. Bring it back down. The other side of it, the TFL. The TFL, the pocket muscle. So finding your ASIS again. And remember the ASIS, and then there is the IT band that runs along the outer side of the leg. And the TFL is kind of in between. So you're going to palpate that, finding that bony protuberance, ASIS. And then below, towards the outer hip, that's going to be your IT band. And finding it kind of in between, you're going to palpate down and just feel the leg rotate. And you'll feel that activation of the TFL. And you can really see that it is kind of where your pockets are. Okay, so TFL, when you internally rotate, you can really feel that muscle turn on. So that outer front portion of the hip, and the glute med is on the opposite side. And the butt, we have glute max, And in the front, we have the psoas complex that is balancing everything else. So you can feel that there's a symmetry in the structure and integrity of the pelvis. The next thing we're going to move on is to the legs. Let's talk about the adductors, the hamstrings, as well as the quadriceps. So to feel the quadriceps, it's the large muscles on the top. It's a little bit easier to feel. So when you engage the legs, if you're standing, it might be easier to just extend the leg up. But if you're sitting, pressing the thighs down and engage. And you can start to feel all the quads begin to tone up. And that big bumpy one down the front, that's your rectus femoris. So that's the one that crosses the hip as well as the knee joint. And then there's the vastus lateralis, medialis, and intermedius in the middle. And so those are the quads. Now the hamstrings, if you're sitting down, you can bend the knees and then just actively press down, press the heels down. It might feel the engagement of the hamstrings. Or if you're in bridge pose, you can do bridge pose. So laying back. And if I lift, I can feel the engagement of my hamstrings. This is a good way to be able to feel the hamstrings. Again, remember you have 4. 2 that connect laterally to the outer knee and 2 that connect medially to below the knee as well. So 4 semimembranosus tendinosus on the inside, and then biceps femoris lateralis longus and brevis, so long and short, on the outside. So how about the adductors? So adductors, they are very powerful, but you can't really palpate them. So they're at the seam of your pants. And a good way to kind of find where they are is to engage your quads and the slight bend in the knees. Keep the engagement of the quads, but also engage your hamstrings. Between your quads and your hamstrings, and that's where your adductors are. And so your adductors are right at the seam of your pants, and they're responsible for bringing the legs together. So let's move into the dorsal region. So rectus abdominis, we talked about this before. It's the six-pack muscle. It's usually the easiest one to feel because it's right down the middle and it's right through the center towards your pubic bone. So trying to curl the tailbone under, and you might engage and start to activate the lower fibers of the rectus abdominis. Say you're doing your crescent here, engaging the rectus abdominis to draw the ribs in, knit them in, and you might start to feel it engage, so contracting. So drawing that ribs in, gentle tuck of the tailbone in. That's how you would engage and find your rectus abdominis. So just remembering that the obliques are kind of making an X across. So when you're doing your bicycle crunches or when doing your cross crunches, those are the muscles that will be activating. And the other one is a TVA, so the transverse abdominis. And you won't be able to feel it. This one is one of the ones that doesn't have a action. Rather, it's completely for stability. But you can feel that lengthening. It's around your whole body. It kind of wraps around you. So imagine when you inhale, you lengthen. And try not to use the shoulders or anything else. Just using the muscles here, the TVA, to slowly hug in. You might feel a little bit more length. So we talked about the front, going to the back. So the muscles that support the front side is the rectus, the obliques, and the transverse abdominis. The ones in the back is the spine, so the rector spinae. So again, 3 on each side. The closest one to the spine is spinalis, then it's the longissimus, and then the iliocostalis. To palpate these, you can first feel the fascia on the back, and you'll feel that it's very smooth, that you almost don't feel anything. But if you start to keep going up, and you might start to feel these ropey muscles, and that is going to be where these erector spinae muscles are. So you may not be able to feel them towards the lower back. The thoracic lumbar column has this band of fascia that covers it and makes it really smooth feeling. But if you go above it, you start to feel these ropey muscles, and that's what you're looking for. And to engage them, you just need to stand up, or you can do kind of like a gentle back bend to engage the back body. You might start to feel these ropey muscles in the back. So we talked about the front, the back. Let's talk about the sides. And the sides are the QL from the iliac crest all the way up to the ribs and to the spine, and they help us hip hike. These are pretty easy to feel. You'll feel them more towards the posterior side rather from the front side because they are very, very deep. So you find the spinal column, go out to the side, find the crest, the iliac crest, right above it, push in, and your legs extended out. You might try to draw one of your hip up, or even just that action of trying to imagine to draw the hip up or side bending. And you might start to feel that engagement when you side bend. And that is the QL, the quadriceps lumborum. And they help support the spine laterally. And they also help twist as well. So you may feel that when you're twisting. Let's go over a couple of the muscles. Some of the muscles are very easy to palpate, so we'll go over them rather quickly. First one's the traps. Remember, it goes from cervical spine to the humerus, down the spine like a kite. And the easiest way to palpate the traps is at the shoulder. Of course, there's more down there, but the easiest way to palpate is at the shoulder. It's that bulky, thick muscle there. That is your traps. And you'll feel that as you begin to abduct the arm away. You can start to feel a little bit of that. Right? Or shrug the shoulders or elevate. Because remembering the traps can also elevate the scapula as well. So when you elevate, you can start to feel that. And then the middle traps can help retract, so when you bring it in, and the lower part can depress the shoulder blade. And for the latissimus dorsi, we talked about the back of the armpit. The lats are also kind of there at the posterior side of the armpit because it attaches to the humerus and it goes down all the way to the sacrum and towards your pelvis. So again, from the back, you can grab in, and the latissimus dorsi is responsible for the extension of the shoulder. So you can start to feel that drawing back and grab back. So it's that meaty part behind your armpit. You can start to feel as you extend the arm back. The last one that I want to talk about, the torso, is the pec major. Pec major, sternum to the humerus. And for this one to feel, you bring your arm forward and just push forward, and you can feel that activation. And for the pec major, that's the front of the armpit. So you can feel it towards the front of the armpit as you push forward. And so that's pec major. One last muscle that we are going to find in the body. I think the other ones are pretty easy. So we'll just do this one last one because it does cover a little bit more area. And again, different portions will do different things. So the deltoid muscle that covers all of the shoulder muscles, the most superficial shoulder muscle. So the front side is going to help flex the shoulder. And as soon as you bring your arm up, you can feel that front deltoid begin to contract. And the upper part, or the lateral part sometimes called, is going to help abduct the shoulder. So when you lift the arm up, you can start to feel that. And the back posterior side of it is going to for extension. So bringing the arm back, you can start to feel that muscle begin to contract and shorten. So that's the deltoid. And so those are the main muscles that you palpate in the body and understand a little bit more about. In the last section of this part is a quiz. And so take a printout or take a look at the quiz, and we're going to try to go through some of these things together again.